Welcome to Plastic Surgery Q&A. Today we're going to be talking about the 10 most common questions regarding breast augmentation surgery. Great question. There's actually 5 different profiles of implants. Just to explain a little bit more, a profile is how much the implant projects or sticks out. So the more projected the implant, the more rounder, fuller appearance. The flatter the implant, the more softer and more natural it's going to look. In my practice, I generally stick with 3 different types of profiles. The low plus, the moderate, and the high or full profile implant. So the low plus profile implant, you can see it's very flat, it's very soft and very natural. I do these on patients who are skinny, thin patients who want just a little bit of oomph, probably about 1 cup, 1.5 cups. The vast majority of patients do stick with the moderate profile implant. You can see it's a thicker implant. It does provide more projection, but it gives you also a continued softer, more natural look. Now the high profile implant, now you can see it really projects a lot, very thick. Okay, these implants tend to project more. These are mainly reserved for patients who need, number one, a breast lift. So patients who have deflated volume or deflated size of the breast, the high profile implant will allow the structure to be fuller. Secondarily, those who want the more fake or almost fake look, the high profile implant's the way to go. So again, these are the 3 ones that I use. Like I said, there's 5. There's even a low profile implant, which is even flatter and thinner than this one. And there's an extra high profile that's even fuller and higher than the high profile implant. So these are the 3 that I mainly stick with. Absolutely. So even though you're 110 pounds, that tells me that most likely you're a very small and tiny patient. That doesn't mean that you don't have any fat. You know, some patients are short, but they have some fat in their love handles or their thighs or their stomach. So, you know, when it comes to fat transfer, it's all about setting expectations. The less fat you have, the less results you're going to see. The more fat you have, the more results you're going to see. So if you're asking if it's possible, it's absolutely possible. You just might not see much of a difference. The implants might be the way to go for somebody small and thin like yourself. I do not. The 2 incisions I use are either around the areola or underneath the breast tissue at the crease. The reason I don't do the armpit is it's considered a blind procedure. Basically, if you make an incision here, think about how you're supposed to release the muscle from the bottom and tighten the cleavage. It's way too far away. Whereas if I'm doing the areola or the breast crease, I have direct visualization of where the implant's being placed, of the pocket, how we're opening it up, how tight the cleavage goes. So as far as results go, I think it's far superior to do one of these 2 incisions that gives us a direct visualization of the breast. And again, the reason the armpit isn't a good idea, a couple of reasons. Number 1, again, it's a blind procedure. You can't really see where you're dissecting. And then number 2, it's in the armpits. There's a lot of sweat glands and bacteria there, so the chances of infection are a little bit higher. I've done a lot of revisions on patients who've done the armpits, and they've come in and sometimes the implants are above, sometimes they're below. They don't know where they're at, and they're kind of all over the place. So again, it's a blind procedure, just like back in the day when they used to do the belly button. They put saline implants through there, but again, you don't hear of that anymore because it's an older blind technique. There's a lot of complications and issues. Same thing with the armpit. It tends to have a lot of complications, and the results aren't quite as nice. So I generally have patients stay out of hot tubs, pools, jacuzzis for at least the first month. Okay, once you hit about a month, it's dirty enough to go into the pool and the water and all those types of things. So usually I would say probably a solid month before you're 100% good to go back to working out, again, exercising, soaking. As far as healing goes, you know, you should have a watertight seal within about that first week. But again, I always like to wait a solid month just to make sure, you know, there's no chances of infection or contamination. As far as full maturity, scars do take a full year to mature, okay? And then after that, it can fade over time. So as the years go by, it just fades and goes away. I do like to use silicone scar cream 1 month into surgery to help the improvement of the scars as it progresses through time. The most common implant I would say is 345 cc's. It's, you know, mid to moderate 300 cc's is probably the most average size implant in the moderate profile implants as well. It really all depends on where you are in your life, in your lifestyle. There are patients that go in two different categories. Number one, there are patients who are like, I want to enjoy my life now. I want to travel. I'm still single. I don't have any children yet. I want to enjoy my body, wear nice bikinis and things. So those patients will tend to get surgery first and their breast augmentation first. Go travel, do their life, have their kids, and then come back for a mommy makeover. The second thought is wait until you finish having kids and then come to do the mommy makeover. So it really just depends on where you are in your lifetime and what you want to do over the next few years. I would say if you're planning on having children within the next maybe 1 to 2 years or so, then just wait till you have children. If you're not going to be having children for 3, 4, 5 years or so, then it might be a good idea, to go ahead and get your breast aug now so that you can enjoy it and then have your children. So it really just all depends on where you are. Scars and keloids are very difficult to treat sometimes. It really all depends on your skin tone. Lighter skin patients tend to scar very well, darker skin patients tend to scar worse. So how do we treat a hypertrophic scar or a keloid? First of all, like I said before, I like to start using silicone scar cream at the 1 month appointment. Patients use that usually for about 6 months or so. If the scars continue not to look as good as it can be, then there's laser therapies that we can do. Plus there's Kenalog injections, which are steroid injections into the scar that can help soften it. At the end of the day, if the scars still don't look great, you can always do a scar revision. Basically, we cut out the scars and close it. Usually the first time around, the scars always heal the worst because there's a lot of tension. Again, when we're doing a breast augmentation, there's a lot of pressure stretching out the skin. So imagine there's a lot of tension across the wounds. When we go back to do a scar revision, you don't have that same tension, so the wounds tend to heal a little bit better. Yes, you can. I generally have my patients go back to the gym in about 1 month or so to do their arms, maybe some push-ups here and there, and rest of the body exercises. I would probably say give me about 2 months before you're really doing some chest presses and chest exercises. So yes, at the end of the day you can, but definitely have to give it some time for everything to heal before you go and do chest exercises. That's to the eye of the beholder. Each implant has their positives and negatives. I personally recommend silicone implants because I like how they look and how they feel. I feel it's superior to the saline implants. So the advantages of a silicone implant, again, better look, better appearance, more natural feel. The disadvantage is that if it were to rupture or to break, you really won't have an idea unless you get an MRI. But nowadays with the gummy bear implants, they don't leak anymore. So even if they were to rupture, it's not like it's traveling throughout your body. When it comes to the saline implants, the advantage is if it were to break or if there's a puncture or an issue with the implant, it deflates and you know right away there's a problem with the implant. However, with saline implants, you have to overfill the implant in order to prevent rippling and some of the other issues that come with saline implants. So it tends to give you more of the fuller, rounder, faker looking appearance. So it really just depends on what you're looking for. Again, I personally recommend silicone implants because of the far superior look, feel, and appearance. Very great question. It's important to understand there are two issues when it comes to possible rejection or your body not liking the implants. The first thing is called ALCL, BIA-ALCL, which is breast implant associated acute large cell lymphoma, and the other one is called breast implant illness. So the worst one is BIA-ALCL, or the acute large cell lymphoma. What happens is your body reacts to the implant, and this has been found to be in textured implants, not smooth implants. So the texturizing of the implants has caused this reaction to create this almost lymphoma type cancer that surrounds the shell or the capsule of the implants. The way to treat it is you go in, you remove the implant, you take the capsule out, and potentially think about either putting a brand new implant or a different kind, or maybe fat transfer. The other type of issue is something called breast implant illness. So breast implant illness is a very undefined, kind of somewhat known, unspecific symptoms that patients get, such as tiredness, lethargy, joint pain, just very non-specific, again, issues, maybe weight gain, can't go to sleep, or not enough energy. Just a bunch of different, just non-specific issues that are associated with the implants. It's almost like an autoimmune type disease where your body's kind of fighting itself and it's fighting the implants, and it's causing some of this collateral symptoms that patients are having. So not really a well-diagnosed issue. We're still kind of learning about it. The treatment for it is to remove the implants. Don't put a new implant in, and just see how the body feels and reacts. If your body feels better, then obviously it came from the implants. Again, another treatment for this is to go and do some fat transfer if you do have some fat that's available to transfer. Thank you for watching. I hope this video was educational. If you guys have any more questions, feel free to type it in the comments below. Otherwise, continue to follow our channel for more information.